Hi everyone, welcome to week 2 of the Psych Collective. First, I just want to say that last night I read over all of your discussion boards and your responses to your classmates, and I'm very impressed by the thoughtful responses you have given and the questions that you posed. I actually took some notes over some of the points that you guys brought up that I thought were really interesting that I just kind of wanted to touch on here. So for the first discussion board, you guys watched the video from NAMI in our own voices and heard some stories from people that are facing mental health issues and kind of what their experience has been. And I thought that you brought up, all had a kind of a common theme here of, not judging a book by its cover, looking at the person that is behind the diagnosis, that they aren't just their diagnosis, being aware, advocating for our patients. One strategy that a lot of you touched on for how can we help people, how can we help our patients is by asking questions, listening. That seemed to be a very key theme that was going on in a lot of the discussion boards. Listening to what's going on with our patients, what they need from us, what can we do to help them. That might answer some questions for us if we listen. We also talked about kind of how do we help patients get resources that they need. And one of, at least one of you had said something in your discussion board that I thought was very, very good. So had the suggestion of having a list of local resources available that you could distribute to your patients if they're looking for therapists or other types of groups or drug treatment facilities. And so I thought that was really great, right? So we talk about in the discussion boards, we need to be aware as pharmacists, we need to ask questions, we need to care, we need to advocate for our patients, but how do we make sure that we actually do those things in practice? So it's one thing for us to say that in our discussion boards here, but I want you to kind of just think, how are you going to make sure that you're doing these things? What can you do? It could be something as simple as kind of a checklist reminding you, when somebody comes in, I'm going to greet them, I'm going to ask these kinds of questions. It might seem like it's a little scripted, but I think that with time, it's going to become just a natural sort of approach to your patients. The other thing that I thought was fairly interesting and hadn't really thought about is, what is the perception of the role of a pharmacist? For somebody in the community that might have a mental health condition, do they go into their pharmacy thinking, oh, my pharmacist can help me beyond just giving me my medication? So some of you brought up about the perception that pharmacist is just somebody that counts pills and dispenses that to patients. But how do we change that perception? And there's a variety of different kinds of, approaches or programs where we're trying to kind of get that information out there that a pharmacist is more than just somebody that's a pill counter, right? But really thinking about how do we change that perspective for people. So what can we do as pharmacists? Another thing that I thought was interesting was, kind of this not judging a book by its cover, but the idea that we all have implicit biases about people and things that even if we don't intend to, they're implicit, so they're going to be there, and there's sometimes things that we can't control. But being aware that we have these biases can help us kind of keep ourselves in check. So when somebody comes in and maybe they are disheveled and muttering to themselves and, their clothes are torn, what are you initially going to think about that person? Are you going to have some preconceived notions about who this person is, how we should be treating them and talking to them? So being aware of those implicit biases. I liked the example somebody gave about eyeglass analogy. So thinking about mental illness in the same way that, somebody that has eye problems and needs glasses to see, there's nothing wrong with that. So, if you have a mental health condition, it's could be a disease, that can be treated with medication. It's no different than, treating diabetes with medication, or like the eyeglasses analogy that one of you guys gave. Also, it says, one of the other things that was brought up is, what do you do for patients that don't have insurance, can't cover their medications and their health care and so forth? So I think that's another really good point and something to be aware of. And this goes beyond just mental health, but just kind of healthcare in general, is what do you do if somebody comes into your practice and doesn't have health insurance? Do you know what resources you can give them? So making sure you're prepared for something like that. Also, there's cultural differences around mental health conditions, right? One of you had brought up that, in your own culture, the way that it might be viewed is very different. And then that's incredibly important and something to take into consideration. Also, in the kind of realm of adherence that was brought up, like educating a patient, this is how the medication is going to work. This is really beneficial to you. This is how it's going to help you. And some of you brought up questions about what if a patient doesn't want to take the medication. So yeah, we can continue to educate them and tell them why this is the best solution. But, some people have brought up about, really reflective listening and asking questions, using some motivational interviewing to find out why somebody might be hesitant to taking medication. You can't force them to do it. They're not going to be agreeable there. And so this kind of gets back into the perspective of patient-centered care. So the patient really needs to be the one that's in charge of the decision-making and as a part of their own care and treatment plan. We can't force people to take medication if they don't want to do that. There's also other options to medication, which some of you brought up, and that's something to consider and to think about as well. So overall, I think you guys had some really, really great responses and reflections, and then posed some very interesting, important questions for this first discussion board and had excellent responses. So thank you very much. I was very impressed. Same goes for discussion board 2. So this was the safe injection facilities ethical. So you guys all had very similar overlapping responses for the pros and cons. So pros being that this provides, really nice safe environment for somebody that is an IV drug user to have access to clean needles, and in the event of an overdose, there's medical personnel there that can help in those situations. And so there were a lot of those kinds of comments that you guys seem to find in the literature and then also that, some of the arguments against these safe injection facilities being that it will promote drug use and increase crime, and people that didn't normally use will now want to use because they can do it in a safe environment. That, you all mentioned for the most part that these were speculation and that there isn't really evidence to suggest that those things would be true. These are kind of just ideas or what we might think happen. And actually some of the literature does not support that. And so I thought that was very interesting. I noticed a lot of you had mentioned blog posts for the against. So again, that's totally fine if that's the only resources that are out there. But just remember, thinking about your hierarchy of evidence, a blog post is not going to be as high quality evidence as a peer-reviewed publication. And it might be that we just have a blog post to go to because we don't really have any peer-reviewed publications regarding the cons of a safe injection facility. There were some very interesting comments brought up about the cost benefit of having a safe injection facility. So if you think about if we're providing people with an environment to reduce mortality due to overdose, provide clean needles, where we reduce the risk of transmission of bloodborne pathogens, HIV, Hep C, then reducing those things also reduces kind of the burden and the cost on the healthcare system, right? So it might actually have a really positive effect on the overall healthcare by reducing some of these more peripheral consequences of IV drug use. The other thing that I thought was really interesting that several of you commented on that I hadn't thought about is if these safe injection facilities are established and they exist, but federal laws say that the IV drug usage, so heroin, whatever, that's illegal, what is the kind of legal ramifications for people that visit these safe injection facilities, right? We're not talking about safe injection facilities for legal drugs or legal drug usage. We're talking about primarily illegal drug usage here. So does this make it more risky for somebody to go there because perhaps law enforcement is waiting for them and is going to arrest them and so forth? What are the protections for people that go and visit these safe injection facilities? Some other arguments that were against them were kind of talking about promoting drug use and making it easier to access drugs. And one thing I just want to clarify is that, and I'm not saying that these were any of your opinions, I think you recognize the kind of error in this way of thinking, is that drugs are not provided at these safe injection facilities. These are places where drug users go with their own drug and are given clean needles, are given supervision when they're doing their injections. And kind of that's the purpose of these, right? So we need to think kind of what's the purpose of a safe injection facility, right? One of the things talking about, oh, it doesn't reduce, or doesn't cure people from, or prevent them from taking or make them want to stop taking the drugs. And so, but is that the purpose of these SIFs? No. The purpose is to give people a safe environment, right? But then perhaps we give them educational resources, references, referrals, other information that is on more of the treatment aspect in people that want to quit using. The other thing, this idea of, people thinking, oh yay, now I have somewhere safe to do it. I didn't think I'd want to use drugs, but now I can do it in a safe environment, so I'm going to try it. One of the issues with drug usage is not so much that people want to do the drugs because they just want to do it. And when somebody's addicted and have a substance use disorder, they've gotten to a point where they're using to avoid or prevent withdrawal symptoms. Okay, so it leads into this negative feedback where to avoid these really awful symptoms of withdrawal, I'm going to use. So it's not so much that they want to continue using because they enjoy using the drug, it's to prevent these really negative consequences of withdrawing from the drug. So that's just another point that I just wanted to make there for you. So great job on your discussion boards. This is week 2. Here we're going to be moving into some topics that have to do with physical activity and diet on mental health that Dr. Burkhart has put together some information and a really cool activity that I'm super excited about that you'll be doing and then having to upload and submit for your assignment for this week. And then Dr. Bacon also has some really excellent TED Talks on mindfulness, kind of burnout meditation, our addiction to smartphones and how that affects our mental health. And she has a couple little lectures too that she's going to give to you. There is another assignment that's related to that. This one is not going to be a discussion board. You're going to do some meditation or mindfulness for a few days. The longer you do it, the bigger the effect you might see on your own kind of emotional or mental well-being. So if you're able to do it for, a few days, please do that. But you'll engage in mindfulness or meditation for a few days, and then you'll be asked to reflect on kind of if you noticed it did anything, maybe it didn't, how it might have affected you. And so this is something that you'll upload individually that I'll be reading independently. So again, you can be very candid about it. I do want to thank, you guys for sharing personal experiences and, personal stories about your experiences with mental health, whether it be yourself or a loved one. So thank you for doing that. Remember, everything we discuss in this course stays within this course and is confidential. So I appreciate you respecting your classmates. All right. So I hope you enjoy week 2. I will see you again for week 3 with another video. And I look forward to seeing how your meditation and mindfulness goes for you for this week, as well as your diet assessment. All right. Take care.